Defendant and counsel are present. Jury's absent. You all prepared to proceed?
Yes, sir.
Everybody ready?
Yes.
Okay. Sheriff, ask the jury to come in, please. Thank you. The state may call your next witness.
Thank you, Your Honor. At this time, the state will call Candace Roland.
Okay. Ms. Roland, come up, please. Ms. Roland, if you could take your oath, please. Put your left hand on the Bible, raise your right hand.
You solemnly swear testimony you give this court will be the truth, the whole truth, and nothing but the truth, so help you God. Yes.
Thank you. Have a seat. Go ahead.
State your name, please.
Candace Roland?
And Ms. Roland, are you the daughter of Karen Berry? who
Yes.
testified?
Yes, ma'am.
And so Amanda Hayes, is that your aunt?
Yes, ma'am.
Do you recall, well, let me ask you first, in July of 2011, were you living in the Katy area of Texas?
Yes, ma'am.
And at that time, your mother and your brothers and your father were living in Richmond, Texas on Skinner Drive?
Yes, ma'am.
And do you recall going over to that residence on Skinner Drive on Tuesday, July the 19th of 2011?
Yes.
And what was the purpose of you going over to your mom's residence that particular day?
To see Amanda.
And how had you known that she was there?
I found out the Friday before that she was coming, and I knew she'd gotten there that Monday morning.
Okay. And so the Friday, which would have been the 15th, before that Tuesday, you had found out that Amanda was coming?
Yes.
And did you find that out from your mother?
Yes.
Had you talked to Amanda about that at all?
I talked to her after my mom told me she was coming. I talked to Amanda later on that day.
Okay. So later on that Friday?
Yes.
And was that by telephone? I mean, you were in Texas
Yes.
at the time?
Yes.
And in talking to Amanda, did you learn the purpose of her visit?
She was just coming to visit, so all I knew.
And at the time that you talked to her on that Friday, did you make arrangements to go and see her Tuesday, or?
No, I was going to go see her, but I didn't have a specific day.
When you talked to Amanda on that Friday, did you have any idea of how long a visit this was?
I thought it was going to be about a week or so, but I don't know that I knew a specific time.
And you indicated that you had known that she had arrived actually on that Monday morning.
Yes.
And was that from talking to Amanda or from talking to your mother?
My mom.
And at some point after that, did you decide that you would go visit on Tuesday?
I don't remember why I didn't go Monday. I may have had something going on, I don't know. And then I knew that they were going to have to go home early, and so I went Tuesday.
Do you recall about what time of day it was that you went over to Skinner Lane on that Tuesday the 19th?
I get off work at 5 and I left from work and went over there, so 5:36 maybe.
And did you drive over there by yourself? Were you with anyone else?
No, it was just me.
And once you got to the residence, you said it's about 5:30 or 6 when you get there?
Yes.
Describe who's there and what you do when you first get there.
My mom was there, Grant and Amanda were there, and then the 3 kids were there.
prior to that date being the 19th, had you ever met Grant Hayes?
No.
And the children, had you ever met the children?
No.
When you got there, what happened? What was did you visit?
I visited with Amanda for a little bit. I'm guessing maybe around an hour or so. I was pregnant at the time, and she had just had a baby, so we talked about that.
And in terms of talking with Amanda, was that kind of one-on-one, the two of you?
No,
talking?
we were just in the living room.
Okay.
I know the kids were in there. I don't remember if, I think my mom was in there some, and she was in the kitchen some. So, but I don't, it wasn't just her and I, no.
Okay. Was Grant Hayes, was he in the living room there as
He
well?
was part of the time, yes.
Okay. Did you have any conversation with him?
I was introduced to him, and that was about, there may have been a little bit more, but there wasn't much at all. I don't remember anything else.
And you've indicated that basically at that point that your discussion with Amanda had related to the fact that you were pregnant, that she had just recently had a child.
Right. Well, I got to see Lily and things like that, yeah.
And you said that you were able to visit with Amanda and talk with her for about an hour.
I don't know exactly, but about that long, yes.
What happened after that hour?
Her and Grant went outside.
And did they take the children with them?
No, the kids stayed inside.
And did you go outside to where they were?
No.
What happened after that?
I just stayed inside with my mom and the kids.
Did you know where Grant and Amanda were going when they went outside?
She had come in a little while later, I don't know how long, and to get some water and all, and she had told me then that that's when I knew they were going fishing, is what she had said. And I told her goodbye then. And
Had you, you indicated that you understood that the visit was going to be cut short. What did you understand about that?
I just, that they were going to have to get the kids back home. And they were going to have to leave earlier because of that.
And was that information that was shared to you by Amanda?
I don't remember if it was Amanda or my mom. One of them told me, but I don't remember who.
You indicated that Amanda told you that at some point that she had come back in and got some water,
Yes, ma'am.
that they were going fishing.
Yes.
Did you find that odd?
Not at the time, no. I mean, my little brothers fish a lot in the evening, so I didn't think anything of it at the time, no.
How long had it been before then that you had last seen Amanda?
That was in July of 11. The last time I saw her was in June of 2009.
So it's been a couple years.
Yes.
And during that time, would you stay in touch with Amanda by phone?
We did some by phone and by email.
During the course of being at your mother's house that evening, did you at some point leave to go get some money from the ATM?
Yes.
And can you describe that in terms of why you left?
I had written a check to Amanda, and she needed some of the cash, before the banks would open in the morning, and I had told her that I could get whatever I could out in cash that evening, and then I could write a check for the difference. So I wrote her a new check, and I gave her whatever the maximum was that I could get out of the ATM that evening.
And what was the reason that you were writing a check to Amanda?
She had loaned me money years prior to all of this, and I was making payments back to her for that, and I was just giving her a payment.
And she had loaned you money. Was that to help with school, college related?
It was just not long after I graduated from college. It was to pay off some debt that I had from when I was in college, and she had given me a loan back then.
And so during the intervening years, you had been gradually paying that
Yes.
back. And do you recall in this particular evening that you gave her $450?
I don't remember exactly. I know on the memo of the check I wrote how much I'd given her in cash and then plus whatever the check was, but I don't remember how much it was.
And did you initially write the check for the whole amount?
Yes.
Okay, so that, well, your man approach.
You might.
Ms. Roland, I'm handing you what's previously been introduced into evidence. It's State's Exhibit A399, and ask you to take it as a photograph of a check that appears to be, have your name and be from your account. Do you
Yes.
recognize that check?
Yes.
And is that the check that ultimately you wrote and gave to Amanda Hayes?
Yes.
And that was on the 19th?
Yes.
And what is the amount of the check?
The check's for $125.
And did you make a notation on the check as to how much you actually gave in cash as well?
In the memo it says loan payment. It says parentheses $125 check, $300 cash.
And you've indicated that initially you would have written the check for the total $425, but Amanda indicated that she needed cash.
Yes.
And so $300 was the maximum you could get from the ATM?
Yes.
Ms. Roland, your mother, when she testified, talked about lending some clothes to your aunt?
Yes.
Amanda, were you there when that happened?
I believe I remember her asking, but I don't remember what my mom gave her or any of that. I don't remember.
And do you remember why she asked for clothes?
I don't even remember if she said why at the moment. I don't remember that.
You indicated that you got there, I think, 5:30, 6 o'clock, and you had visited for about an hour or so. Was it about 7 or around there when Amanda and Grant left the house?
Yes, somewhere in there.
And how long were they outside before she came back in to get water?
I was only there for a few hours, so, I mean, within an hour, it may have been 15 minutes, but, I mean, it wasn't over an hour, I wouldn't guess.
So you would say an hour at the most?
Yes, I think so.
And when she came back in to get the water, did you then have further conversation with her at that point?
She asked me if I was going to be there for long, and I told her no, that if they were going across the street, I was going to go home soon, and we said goodbye and all, and I gave her a hug, and that was about it.
And so, after that, go on.
At some point, I went and got the money. We
had more attorneys earlier.
Got that back and gave it to my mom, put it to her, or left it for her. I don't remember if I laid it somewhere for her or gave it to my mom. And then I visited with my mom for just a little bit and went home.
So the conversation about needing the cash was prior to you saying goodbye to her?
Yes.
And then you went and got it after that?
Yes.
Do you recall about what time it was when you left for home after you'd gone to get the ATM money and brought that back?
I would guess maybe around 9.
And at that point, Amanda and Grant didn't come back to Roland?
No, I didn't see them after anymore.
Had you spoken with Amanda about the custody situation involving Grant before in general?
I mean, I knew there was a custody, and we had little light conversations about it, but nothing in detail or any of that. I mean, I knew that they were going through the evaluation and stuff like that, but I didn't know details of it.
And that was not on this particular visit, but prior to
Yes.
that. On this particular visit, did you come to understand that they were leaving to take their children back for a visitation or a custody exchange?
I knew they had to get home because they had brought the kids with them. I don't know. I don't remember if they told me, or whoever told me, if it was because they had to see their mom or what. I just knew they had to get back because they had brought the kids.
After they you know that they were planning on leaving that Wednesday morning at that point when you left on Tuesday?
Yes.
And did you, on that Wednesday, the 20th, did you try to contact Amanda by phone?
Yes, I did.
And do you recall when you did that? Or are you-
It was around lunchtime because I had left work for lunch and I knew that they were leaving and I was just going to call. I told her the night before to call in the morning before they left so I could say goodbye. And I was just calling on my lunch. I didn't get them.
And did you actually call twice from 2 different numbers to try to get up with them?
I don't know. I could have. I don't remember how many times.
Did you have, at that time, a number that ended in 1220?
Yes, that's my home number.
And did you also have a number that ended in 0648?
That's my cell phone.
And your memory is that you tried around lunchtime
Yes.
on that day to get up with Amanda.
Yes.
And what happened when you made those phone calls?
No one answered.
Do you recall if you left a message or were able to leave a message?
I don't remember if I did. I would think I probably did just because that's me, but I don't know that. I don't know that for sure.
And do you recall what your mother's number was at that time?
Her cell phone,
Mhm.
I believe it was 9978 were the last 4 digits.
And did she also have a phone number ended in 3010?
I believe that was the house phone at the time.
Is that an area code 281?
Yes.
Thank you, that's all I have at this time.
Questions?
Madam Manager.
Sure. Thank you, man. Thank you. Okay, next witness, please.
Your Honor, the state calls Dr. Deborah Radish.
All right. You'll swear that Rose, please. Okay. Thank you.
Promise by the testimony of this court, the truth, the whole truth, and nothing but the truth, so help me God.
I do.
Thank you.
You may proceed.
Thank you, Your Honor. Dr. Radish, could you state your name for the court?
Dr. Deborah Radish.
How are you employed?
I'm employed as a forensic pathologist, the Chief Medical Examiner of the state of North Carolina in the Office of the Chief Medical Examiner in Raleigh.
And how long have you been in that office?
In my present position,
Yes, ma'am.
about 3.5 years.
So for 3.5 years, you've been the Chief Medical Examiner for the state?
That's correct.
And prior to being the chief, did you work in the medical examiner's office prior to becoming chief?
Yes, I did.
And how long did you work there?
I've worked in the Office of the Chief Medical Examiner for the majority of the time since July 1983.
And could you tell the jury about your schooling and education?
I graduated from the University of North Carolina at Chapel Hill in 1976 with a BS degree in medical technology, and then I attended and graduated from what was then called Bowman Gray School of Medicine. It's Wake Forest University, graduating with a medical doctor degree in 1980. And then I returned to Chapel Hill for postgraduate or postdoctor training, 2 years each in the fields of anatomic, clinical, and forensic pathology.
And after you completed that work, where did you go next?
I'm sorry.
After you completed that work, or that education, where did you do next in your career?
After that, I obtained board certification in those fields of anatomic, clinical, and forensic pathology, but my first position was as a hospital pathologist at Mariah Parham Hospital in Henderson, North Carolina, until December of 1987, when I was offered a position back in the medical examiner's office as Associate Chief Medical Examiner. And I took that position starting December of 1987 and remained there until July 1st, 1994.
You mentioned your certifications. You're board certified in anatomical, clinical, and forensic pathology.
Yes, sir.
And you've maintained those certifications up until today and through today?
Yes.
Okay. And you're licensed to practice in the state of North Carolina?
Yes, I am.
And how long have you been licensed to practice medicine?
Since August 22nd, 1981.
Do you have any teaching role?
Yes, I'm a clinical professor of pathology at the UNC School of Medicine in Chapel Hill, and I have an adjunct associate professor position in teaching at Duke University School of Medicine.
And can you explain to the jury what a forensic pathologist does?
Forensic pathology is kind of a subspecialty of medicine. So first you get to be a doctor, and then you take some specialty training, and my specialty training was in the fields of anatomic and clinical pathology. Anatomic pathology primarily deals with autopsy pathology, performing a postmortem examination to determine the diagnosis of a disease process and its extent
Ma'am, this is
on
a
the body.
Bible right here.
But
If you put your left hand on the
most
Bible and raise your right
pathologists
hand,
go
please, and
into
place the
surgical
quote, take your
pathology.
oath.
So if you have a tumor or something removed by a surgeon, that specimen will be submitted to the pathology laboratory, and the
Thank you.
pathologist in that role will look at that tissue and make a diagnosis that can be used to help treat the patient. Clinical pathology is those doctors primarily supervise the laboratories
All right, you
that
might
would be
pull that
testing
mic up a
blood
little bit
specimens
closer
or
to you
urine
if you
specimens
can.
again to diagnose and follow disease processes. And so they make
You may
sure that
proceed.
the labs are doing the right tests properly, and they
Karen
also
Berry.
can consult about the meanings of tests. So forensic pathology uses the skills from anatomic and clinical pathology, mostly anatomic pathology and mostly the autopsy, in order to perform autopsies and investigate deaths due to sudden unexpected causes, or those deaths due to external causes or violence.
Amanda Hayes. And
Yes, sir.
You mentioned that who's Amanda? She's medical examiner.
She's my sister.
You still perform autopsies?
Yes, I
And
do.
where are you from? How does your
Katy,
I guess,
Texas.
chief role differ from the role that you do? You live over on Skinner Lane outside of Katy,
It's, as
Texas?
you
I
would
used
imagine,
to.
a whole lot of administration and meetings and
And if you could,
mediating problems, that sort of
when you
thing.
lived there at Skinner Lane back in July of 2011, who lived there with you?
My husband, I, and my two sons, Shelton and Dalton.
The court accepts it under.
Do you have any more children?
Yes, sir.
And could you
Yes,
tell us
I
about
have.
those kids?
I have an older son, Daniel Berry, a daughter, Candace Roland, and a daughter, Randy O'Connor.
He's the chief medical examiner for the state of North Carolina.
Yes, I was.
And back in August, Ms. Berry, could you tell us, did you grow up with Amanda Hayes? Texas?
No.
Dallas, and could you explain that?
Yes.
I was older than she was by quite a bit, and I had already moved out of the house. She was born, I think, when I was probably about 14.
And
The
can you see
remains
that
had
microphone
been
as close to you can?
FedEx shipped to
We're
our
gonna make sure that
office,
everyone
and
Um,
they were received in a large
Now,
rectangular
as,
box that had been
2010
marked
turned into
with
2011, were you aware
an
that
investigator
Amanda had been
detective's
married?
name and
Yes, I was aware
a
when
date.
she was
And
married.
so
You
it
found
was
out
this
that she
big
was
shipping
married to
container
Brandon
that
Hayes in April
was
of
sealed,
2010.
and then we proceeded
Yes, I
to,
believe she had
open the
called me
seals
a little bit
and,
ahead of time and told me
photograph
she was
along the
planning
way,
to be married.
until we
And in
got
2011,
to
did
the
you
first
become
bag
aware
of
that she was
contents, which
pregnant?
was just a large
Yes.
black body bag.
And
But
she
then
eventually had a
opening that,
child
there were
in
several
June of 2011.
Yes.
different bags with different
And,
body sections
When
identified.
Amanda was
with,
pregnant, did y'all talk on the phone?
3 different
Yes,
autopsy
sir.
numbers
Okay.
from
How would you describe
Texas.
your relationship in 2011, I guess early 2011, with Amanda? Some tape and evidence tape. The writings on that tape.
Just
what was the name?
Normal relationship.
Well,
Would
it
you-
was
would you talk on the
abbreviated
phone every
DT
day
for
or
Detective
week
B.
or month?
Witchard.
I don't really know exactly how often. We probably talked a little more than the year before, just simply because she was pregnant.
Box that contained the remains. Were any of those taped down areas or any of those seals, do they appear to be ripped or torn or affected in any way?
Not that was obvious, no, I didn't think so.
So at that point, you take out a black body bag, is that correct?
Yes,
And you mentioned that there were the body bag was labeled with 3 different parts.
right, different bags had 3 different numbers, and we've found out later that those numbers corresponded kind of chronologically to when the different sections of the body were recovered in Texas and then taken to the medical examiner's office there.
And this jury's heard from Dr. Mamba, but were the bags labeled, did they end with 273, 280, and 299?
That's correct.
Okay, and those are the information that you got from talking to folks in Texas, those were the 3 different autopsies?
Yes.
Did you also have occasion to talk to Dr. Postilnick in the Galveston County Medical Examiner's office?
Yes, I did.
And at that time, was he the chief medical examiner?
Yes.
Okay. And I guess, did you acquire some information from a Dr. Stinson that there had been some etching shown on the teeth of that body?
I believe that that information was transmitted to me by Dr. Postilnick.
Okay. Now, I guess, drawing your attention to these 3 separate bags, the first bag was number 273, is that correct?
Yes.
And the bag labeled 273, what did that contain?
The bag that was labeled 273 had several cervical vertebra or the vertebra or pieces of spine from the neck, and also had there was another body bag. There were 2 body bags that were labeled 273, and the other one was a silver body bag, and that had the chest and pelvis, so kind of the torso, but 2 parts of it.
Your Honor, may I approach a witness?
You may.
Dr. Radish, I hand you this march for identification purposes of State's Exhibit A513. Is that a copy of your autopsy?
Yes, it is.
Your Honor, at this time I move in that State's Exhibit A513.
Let me receive.
Your Honor, may I publish this via the projector?
You may.
Yeah. Dr. Radish, across the room, do you see the report of your autopsy examination?
Yes.
And skipping down to the second page, is this what you've been talking about, that the part labeled 273, that was the C vertebrae and then also the 2 torso parts that you received?
Yes.
What was in the area that was labeled 280?
280 contained, it was a black body bag that contained what looked like a portion of soft tissue or muscle from the leg, and I believe that was all that was in that one.
And then the last body bag that was labeled 299, what did you find in that body bag?
In 299 had part of looks like part of 273 in it, but the remainder of the body was there were portions of skull and what were called pieces of the base of the skull.
When you received these body parts, it appeared that the materials from each of these autopsies had been mixed together in these 3 bags?
Well, what was also received was a box that contained multiple small, like plastic specimen containers with portions of bone which had been removed in Texas and submitted to us so that tool mark analysis could be done on those bone pieces.
And those bone pieces that were, they appear to be, I guess one side had tool marks from the perpetrator of the crime, and then the other side, was it stained at all?
No.
Okay. So at that point, did you have to attempt to discern which side you needed to investigate?
Well, since we knew that they were going to go to the forensic anthropologist, we left that up to her.
Okay. Your Honor, can I approach the witness?
You may.
Dr. Radish, I handed you this been marked as State's Exhibit A509 and A510. Are these you mentioned forensic anthropologist. After you finished your autopsy, or as part of your autopsy, did you send these body parts and these cuttings on to an anthropologist?
Yes, we hand-delivered them to her.
And who is that person?
Dr. Ann Ross at North Carolina State University.
And State's Exhibit A509, is this part of Dr. Ross's report in examining those body parts?
Yes, State's Exhibit A509 is the report on the first tissues that bones of tissue, but the first bones that we submitted to her.
And does that include a table of the remains and the container that they came in, whether there was soft tissue included, whether there was formalin included in this report?
Yes, it is basically an inventory of what we gave to her.
And at some point, did you receive the autopsy report, these 3 different autopsies from Galveston County?
Yes.
And I guess at some point, did you realize that there was a difference between the materials you had and what Galveston County believed they had found?
We actually realized that when we did our first inventory, because things were labeled one way and we disagreed with the labeling on several, and then the anthropologist then confirmed that.
Okay, and so Dr. Ross then went through and marked if these different body parts and sections were different than what was perceived in Texas?
Yes.
Okay. And then State's Exhibit A510, is this another report that you relied on in completing your autopsy?
Yes, it was incorporated, I believe, and so State's Exhibit A510 is just tool mark analysis on the, let's see, one of the femurs.
Okay. And so, I guess to clarify, so State's Exhibit A510 is a report that Dr. Ross did in comparing the tool marks on one of the femurs, and she also used a tool on a pig proxy to compare those.
That's correct.
Okay. Both of these, A509 and A510, did they help you in completing your autopsy?
Yes.
Okay. And Dr. Ross was, took on the task of trying to identify all these cuttings and determine what parts of the body they belong to?
Yes.
Okay. As we move on in your autopsy, do you state in here that the plastic containers were inventoried and all the pieces of Laura's body that you received, that those were all inventoried?
Yes.
And part of that, I guess the best summary of that comes from Dr. Ross's report in State's Exhibit A509, where there's that table.
Yes.
Okay. Now, after you discerned what you had, at that point, did you begin looking for injuries to the body?
Yes.
And I guess to start with, maybe could you tell the jury, when you have a dismembered body, how do you go about trying to investigate the cause of death?
Right. Well, generally what will happen, you won't know who the person is, but the identification had been made in Texas, so there was no reason to redo that identification, but that would incorporate doing radiographs. So we would do x-rays both for identification purposes, to use for comparison, as well as looking for any sort of injuries or foreign materials. So the first step before we even really looked at anything was to get the x-rays.
Your Honor, can I approach the witness?
You may.
Dr. Ross, I hand you, it's been marked as State's Exhibit A514 for identification purposes. What is that?
State's Exhibit A514 is a paper copy of one of the x-rays that was performed in this case, and it was basically, to our view, a really unidentifiable mass of soft tissue, but the x-ray showed a faint radio density, or a brighter area that we investigated further and saw to be the cartilages in the neck.
Okay, so to clarify, you've got a body part, or for lack of a better term, a group of body parts lumped together and you x-ray that to see if there's bullets or any sort of projectiles or anything else like that inside.
That's correct.
And on this exhibit states A514, is that the radiograph, the x-ray of that?
Yes.
And in that exhibit, you notice some bone structures that you later identified as being parts of a neck.
Yes, we confirmed that was.
Your Honor, I would move to admit State's Exhibit A514 at this time.
Let me receive.
And Your Honor, if I could pass it on to the court, I'd seek to publish this via the projector.
You can publish.
And Dr. Raj, before I put this up there, this is an x-ray of a body part, is that correct?
Yes, it's a paper copy of an x-ray.
I'll show you State's Exhibit A514, and Madam Clerk, please dim the lights. What are we looking at in the center of the picture? This object in the center of the picture, what is that?
Well, I can't tell you for sure. It's some type of, it's like a soft tissue or muscle or something, but the body is decomposed and has been in water, and so it's very difficult to say exactly what it is or where it came from.
And then in the top left part, is there another mass of tissue that you received?
Yes.
And inside that mass of tissue, could you point out to the jury what, if anything, you noticed?
Okay. This area here, you can see it's a little bit wider, and it's kind of, there's a curved bone here, or some pieces of bone. That's the hyoid bone. And then these more, kind of more rectangular pieces are, or areas of radiodensity, are the thyroid cartilage. And it shows up in there, it starts off as cartilage, which wouldn't be so obvious on x-ray, but with time, as people age, the cartilage becomes calcified, and that's why it's showing up in the x-ray.
Your Honor, may I approach the witness?
You may.
Dr. Radish, I'll show you what's been marked for identification purposes, the State's Exhibit A517. Is that a diagram of the throat area?
Yes, it is.
Would that help illustrate your testimony to the jury about where the hyoid bone is located?
Yes.
And I show you State's Exhibit A516. Is that a picture that was taken of the hyoid bone that was recovered from this, this body?
Yes, it's a photograph that we took of the hyoid bone and the part of the thyroid cartilage that survived the cleaning process.
And then I'll show you State's Exhibit A518 and A519. Are those more radiographs?
Yes, they are. They're more copies of radiographs. That's correct.
And what area is x-rayed in State's Exhibit 518 and 519?
State's Exhibit A518, well, they're both radiographs of the neck organs of a similar age female decedent. And in the x-rays, you can see the tongue and the neck organs and the upper airway. So we're looking at the same areas with the hyoid bone and thyroid cartilages. And A518 is before I do any manipulation to that, before I dissect it and look more carefully at it.
I apologize for interrupting you, but A519, is that after you manipulated?
That's correct.
And we'll get to
Okay.
what you did in a second, but A518 and A519, those are a different person than Laura Ackerson?
That's correct. But
You-
they're the same person, but not Laura Ackerson.
Okay.
That's correct.
And would those help illustrate your testimony about the thyroid and throat area?
Yes.
Okay, Your Honor, at this time I move to enter State's Exhibit 516, 517, 518, and 519.
Let me receive.
Your Honor, if I could pass State's Exhibit 516, 518, and 519, I seek to publish these via the projector.
I've got 16, 18, and 19. You also mentioned 17?
Yes, and 17 is just a diagram. It's
Okay.
Dr. Radish.
All right. Let them be received. You may publish.
Dr. Radish, starting with State's Exhibit 517, is that before you up here on the projector screen?
Yes.
Obviously this is I guess a diagram of the throat area. If this was inside a person, which way would their face be pointed?
The face would be pointed towards the jury, so this person would be looking at the jury.
And could you point out where the hyoid bone is located?
Right. The hyoid bone is at the very top of this diagram, and you can see, you know, 2/3 of it basically. You can see that it has a U shape. So this part looks just the same on the other side.
And with the radiograph that we were just looking at, this area of the radiograph, the U-shaped area, that included the hyoid bone, and what other part of the body was there?
Well, yeah, mainly this area here is the hyoid, and then the thyroid cartilages are these areas here and here.
And in this x-ray, are we looking down on the, or can you tell?
More or less, yes.
Okay. And showing you State's Exhibit A517 again, could you point to where the thyroid cartilage is?
Right, so there's some muscle between the hyoid bone and the thyroid cartilage, but this whole structure is kind of the thyroid cartilage down here.
And you mentioned that as a person grows, is the hyoid bone connected to itself and to other bones in the body?
As the person ages, it is, but when you're young, it starts out as 3 separate sections, and it's kind of like the bones in the skull that knit together, and then you don't have a soft spot anymore. These bones, these 3 bones eventually knit together to make one firm, calcified, U-shaped bone.
When you did an examination of this body, what specifically did you see in relation to this hyoid bone?
As I mean, it wasn't fractured. It was
Okay.
just in 3 pieces.
It was in 3 pieces.
But each of the pieces was not injured.
And for a person who's 27 years old, would you expect those 3 bones to have ossified and connected by the time they were 27?
Not necessarily. That's still fairly young.
I guess, can you point to where the hyoid bone is, utilizing your own neck for the jury?
The hyoid bone is right up at the very top of the neck, kind of underneath your tongue. So it has connections to the tongue as well that aren't shown here, but it would be just as far up as you can feel in your neck, and under your chin.
And then could you point to where the thyroid cartilage is located?
That's basically the Adam's apple. So it's easier for some people to feel and see than others. But that's just the part with the little bump in front of your neck.
The hyoid bone you mentioned appeared normal. It was in 3 different pieces, but that wasn't reflective of being broken or anything.
That's correct.
What, if anything, did you notice about the thyroid cartilage in that section of the neck?
In both in the X-ray and then in my examination, the thyroid cartilage was crushed.
And obviously there had been a previous autopsy done. Is that accurate?
Yes.
Okay. At some point, were you told or did you become aware that Dr. Mondo claimed that he had cut down the back of the thyroid cartilage and then cracked it open?
Yes.
Okay. And someone who did that to the first of all, do you do that when you perform an autopsy?
Yes.
Okay. When you do that to the thyroid cartilage, would it appear similar to what you saw when you looked at this thyroid cartilage that you received from Texas?
Not in my experience, no.
And Eric, have Rich with us.
You may.
Based on your experience, how would you expect the thyroid cartilage to look if you cut down the back of the thyroid cartilage and then cracked it open?
There might be a single crack down the center, or it might even not even require cracking that cartilage to open the airway from the back to take a look at the vocal cords and the lining of the airway.
And then after, I guess based on your experience, did you then examine another body, specifically the thyroid cartilage area, and take x-rays before and after you manipulated it as Dr. Mambo said that he had?
Yes.
Okay. And are those States Exhibit A518 and A519?
Yes, they are.
Your Honor, can I publish States Exhibit A518 at this time? And Dr. Radish, I guess, is this upside down?
No, not really. I mean, the letters are, yes, but the tissue is correctly oriented. So at the top is the tongue. This is the tongue. And these slightly brighter areas or whiter areas are the like the hyoid bone. And then this going down to the top of the airway.
And does it appear that there's I guess, a hollow space in the middle where the airway is located?
Yes.
Okay. And this, again, is not Laura Ackerson. These are different remains?
Yes.
Okay. And then, is this before you've manipulated or done anything to this airway and thyroid cartilage area?
Yes, this is before.
And then I'll show you States Exhibit A519. And is this after you had done what Dr. Mambo claimed he had done and cut down the back and cracked open the thyroid cartilage?
Yes.
And first of all, in this exhibit in States A519, what do you see?
Well, other than what I've done, which is, cut sections across the tongue and open the back, so this is a little wider looking than the previous one, and it's a slightly larger magnification, so you can see this, but you can still see the bones and the thyroid cartilage, and both from my performance of this as well as the x-ray, there's no crushing of the thyroid cartilage.
And how would this image, States Exhibit A519, compare to the thyroid cartilage of Laura Ackerson?
Well, this is intact and not crushed.
And that thyroid cartilage was crushed together, is that accurate?
The two sides of it both looked crushed and not intact.
And if someone was strangled, would it lead to that sort of injury to the thyroid cartilage?
That's possible.
Okay. And do you know exactly how? I mean, is there a specific medical diagnosis for how thyroid cartilage gets crushed?
The most common way would be direct pressure on the thyroid cartilage, and it would take quite a bit of pressure because it's a pretty resilient, being cartilage, it's a relatively resilient tissue. So direct trauma that could include, hitting the neck just right or wrong in a motor vehicle crash or something like that, or direct trauma from a blow from something or from hands.
Okay. And so if someone was strangled, it might lead to this type of injury?
It's possible, yes.
And if someone, I guess, stood on someone's neck with their foot, could that lead to this type of injury?
Yes.
It would have to be some significant trauma to that thyroid cartilage?
Yes.
I guess moving on from this neck area, did you also notice some discrepancies between what you saw and what what the Texas medical examiner saw?
Yes.
And did you list those in this autopsy?
Yes.
And specifically, did you notice a discrepancy in where Texas believed that a cut site was at C6, it was actually at C5?
Yes.
And what the Galveston medical examiner noted as the left tibia was actually the right tibia?
Yes.
And the other ones are listed there, a difference in where L2 was cut?
Yes.
Okay. And additionally, at the bottom you listed the Texas said it was at the base of the skull, and you found there to be several cervical vertebrae fragments.
Yes.
those vertebrae fragments from the head that were they still connected to the head when you received them?
No, they weren't. The tissue had been cleaned.
Okay. Did you give those vertebral fragments to Dr. Ross?
Yes,
And then Dr. Ross was to go and examine those?
yes.
When you received the skull, what shape was the skull in?
The skull had also been cleaned of tissue, and some teeth remained in the skull, but I was also informed when I spoke to Dr. Postilnick that some of the teeth had inadvertently been discarded at the ME's office in Texas.
And this was after Dr. Stimson had already made his finding that there was acid etching on the teeth?
Yes.
Your Honor, may I approach the witness?
You may.
Dr. Radish, I hand you what's been marked as State's Exhibit A515 and A520. With respect to A515, is that an image, what is that an image of?
State's Exhibit A515 is a close-up photograph of the neck tissues that we found in this massive tissue before we removed them from that tissue.
And what, if anything, does that show you as part of your investigation into this body?
It shows a small, primarily it was taken for the relationship of this tissue and whatever it was within. It shows some irregularity of the cartilage.
Okay, and that's again, that neck cartilage?
Right, the thyroid cartilage.
Okay.
Mm-hmm.
And Your Honor, at this time I move to enter State's Exhibit A515 and I don't seek to publish it.
All right, let me receive.
And State's Exhibit A520, is that an image of the skull?
Yes, it is.
And is, I guess, all the tissue been removed from the skull at that point?
Yes, and there's also been a cut through it to remove what was left of the brain, and then all the teeth that were received.
Your Honor,
Yes, sorry.
I'm sorry. I have moved to enter State's Exhibit A520 and I don't seek to publish this.
Let me receive. Neither of these will be published. Thank you.
And just looking at State's Exhibit A520 again, as part of your investigation, the skull is examined?
Yes.
And did you find any skull fractures?
No.
Your Honor, I don't know if the state intends to publish those on the screen. We would object to.
They're not going to.
When you continue to perform this autopsy, did you examine areas where you believe there to be tool marks, and are those which you forwarded on to Dr. Ross?
Yes, well, we looked at the containers to try to see if there was, to see if we could organize them a little better for Dr. Ross, but we didn't want to disturb them a lot because we wanted her to be able to have them the way that they were received by us. We did remove a couple of lower ribs that we thought might have some additional injuries on them, and we submitted those to her as well.
And this exam that you conducted, was that conducted back on August 17th of 2011?
Yes.
Okay. And Your Honor, I've asked to use this skeleton, and
Okay, sure.
I'd ask if Dr. Radish could step down.
Sure.
Dr. Radish, before you, is this a skeleton?
Yes.
Okay. Now, at the time that you received this body, were you made aware that there are cuts to the C6 vertebrae?
I think that's what they said.
And then you later determined it to be C5.
Yes.
And could you point to, utilizing this skeleton, where C5 is located?
Okay. Right here.
around that area?
It's around the area of the Adam's apple. And then on your own bodies, there are 7 cervical vertebrae. So in the back of your neck, the one that points out, the most prominent one in your neck, that's C7. So 2 short ones above that would be C5.
And the C5 vertebrae, did you receive that as part of the skull?
Yes, I think so, but it was, it ended up, I believe, being the vertebra that were in pieces that had been originally labeled as base of the skull.
At some point, I guess you're made aware that there is a cut site to the right humeral head.
Yes,
And could you show sort of the plane of that cut?
it would be approximately across here. The humerus is the upper arm bone and the head of it is there, so across there.
And then there's another cut to the left clavicle. Could you demonstrate for the jury where the left clavicle is?
This is the left clavicle or collarbone.
And in order to cut through bone, could you describe how hard it is to cut through the tissue and bone of the shoulder?
Well, if you're going to cut, for example, through the left humeral head, this is it's a sturdy bone with a thick outer core and even thicker up here where the bone, has to work in the joint. So it's relatively thick bone, so that would be one variable that would make it difficult to cut through. And then, of course, whatever you're cutting with needs to be sharp, and so that will determine the amount of force needed to use that tool.
And then there's another cut site to L2. Could you, now if I could turn, I guess.
Yeah, it'll be easier. So there are 12 thoracic vertebrae, and then when we run out of ribs for those, we start with the lumbar vertebra. So, and there are 5 of those, so L2 would be this one.
And could you point to roughly where L2 is on your own body?
That would be just the kind of your upper lower back, I guess.
It would be approximately equivalent with the navel or belly button area?
About, yes.
And then additionally, were you made aware that there's a section of lower torso found?
Yes.
And the cut sites on the lower torso, I believe there was a cut from L2 down to 1 inch below the right femur, a half an inch below the left hip joint. Could you roughly point to where that is?
There, on the right, this is very approximate, but on the right, basically we're talking through the tops of both femurs or thigh bones.
And additionally, there's a cut through the left ischial tuberosity. What's does that refer to?
It's a part of the pelvis on the left. Show you that this is more ilium, so
Okay.
down here, near the joint.
To cut through that part of the body again, would that be rather difficult? Is that a pretty, I guess, sturdy area of the body with a lot of bone?
Yes, it is.
And then additionally, were you made aware that part of a right lower leg was found?
Yes.
And the cut site, I believe, for that was the lower leg below the knee. Do you recall
Right.
what section you received? I guess if I could
Yeah.
turn this back.
Again. So I believe on the right it was below the kneecap, below the joint, and then I think on the left it was a little higher than that, but more through the joint.
I guess if I can move this back, so we should see a little together. The cut was below the knee, and then could you describe to the jury a decomposing body, the ankle area? Are those bones subject to falling apart as the body decomposes?
Well, they're small bones, and they're not necessarily held in maybe as tightly with such strong tendons and connections, so they could be lost.
And then I believe we heard some testimony that there was part of a femur found.
Yes.
Could you indicate the areas of the femur that you reviewed?
Yeah. That was the one that came in last, and I think it was the left femur.
Okay.
But that would be most of this bone, and I think that they had cut some bone out of it for DNA testing, but had maintained the tool mark ends of it.
You mentioned that there were some cuttings that you received in specimen jars.
Yes.
Is that correct? And so on one of these cut sites where there was a cut through the bone, it appeared that there had been another cut made by Dr. Mambo to preserve that area of the bone.
That's what we had asked them to do, thinking that they would mark which side they cut.
And then you ended up, neither side was marked, and you had to figure out which one came from
Right.
an oscillating saw versus whatever.
Well, and also in conjunction with photographs that were made and getting the reports and discussions.
And you got the reports and also got the photographs that they took as part of their
Right,
autopsy.
and Dr. Ross got those as well from
Okay.
Easton with her analysis.
Okay. If you go resume your seat. Thank you. Doctor, as part of your examination, I guess you sent those cuttings off to determine if there are tool marks made.
Yes.
And are tool marks, could you describe briefly how you see tool marks on bone?
How do you see them?
Yes, ma'am.
Primarily, it would just be an irregularity that would, an irregularity in that they don't belong there, but they would have a kind of a regular patterned appearance.
And additionally, did you mark areas of the body that you received with the tissue on it that appeared to have some sort of cuts or scrapes to them?
Yes, that was kind of part of my external examination and what I could do with an autopsy on the tissue that remained.
And if I turn your attention to the last page, did you have a diagram of, I guess, the parts of the body that you'd received?
Roughly, yes.
And did you note, I guess, on the back areas of the body where you noticed these cut sites?
Yes.
There are cockroach cells.
All right.
Those cut sites, did you notice, could you discern how those cut sites got there, if they were before death or after death?
I couldn't tell because of the state of the tissue.
This body, how would you describe the status of the tissue in terms of decomposition?
I think I said that, let's see, I called it decomposed, and I don't think that I tried to, qualify that here, but the tissue was discolored in different colors. It was kind of gray in areas and had different pigments in other areas. And the outer layer of skin had sloughed away, wasn't present anymore. So the tissue was very soft, had a malodor, and the structures in the skin just, or the tissue just tend to start kind of melting together with the decomposition, so you can't really identify individual muscle fibers or necessarily pieces of tissue just by looking at them. It was in that type of state.
And so the status of the body as it was recovered made it difficult for you to do your examination?
Yes, it's never an ideal examination because I kind of call it, it's like poor resolution compared to a fresh body.
Those cuts that you saw on the back of the body parts that you received, could those possibly have been been caused by marine life in the water where the body had been sitting?
Some of them could have, yes.
And depending on how the body had been transported or how it came to rest, could that also control where, I guess, the blood pooled in that body?
Yes.
Moving back to this third page of your autopsy, did you list the bones that were examined for tool marks?
I'm sorry, what?
Did you list the bones that were examined for tool marks?
Yes, I think probably in general, yes. But what we did was take all the containers over to Dr. Ross and then let her perform the formal, what we would call the official inventory of those bones, because that's her subspecialty.
And when you got that report back from Dr. Ross, did you learn that the tool mark report showed that the saw blade that had been used for these cut sites had 14 teeth per inch?
Yes.
And also on this autopsy, it notes that the right proximal tibial shaft fragment, could you describe first of all where that area of the body is?
Point
I'm looking
to
at the second
okay.
paragraph on the third.
Right proximal tibial shaft. So the tibia is the larger bone in the lower leg below the knee, and this is on the right, and proximal is the end of the bone closest to the head of the body. So it's nearest. Proximal is nearest. So the right nearest large bone of the right lower leg. Yeah.
And that showed 3 false starts, is that correct?
Yes, according to Dr. Ross's report.
And Dr. Ross really determined where a false start was and all the report about the tool marks?
Yes.
Additionally, did you learn some information from Dr. Ross about other injuries to the body, including the vertebrae?
Yes.
Okay, and did she note, was that useful for you in making your opinion about the cause of death for Laura?
Yes, it was.
And I guess, did Dr. Ross inform you, and as part of her report that's before you, that there was a puncture wound to one of those vertebrae?
Yes, we had seen that ourselves before we took that over to her, but she confirmed that it was a traumatic injury and not, part of a natural disease process or an anomaly of that bone.
Which vertebrae was that puncture wound noted?
That was on the 4th cervical vertebra.
Could you point to roughly that area?
Yeah, well, it was the one above the one I pointed out on the skeleton. So again, we're getting a little higher up in the neck, so maybe over the Adam's apple, but getting close to the jaw at that point.
You noted in your autopsy that puncture wound was consistent with a sharp trauma injury?
Yes.
And that was on the anterior side of that 4th cervical vertebrae?
Right, so the front of it, of the body of the vertebra.
And you mentioned that the 5th cervical vertebrae was fractured in multiple areas?
Yes.
And that there are also saw marks detected on the ends of many of these cut sites?
Yes.
A stab wound, a puncture or stab wound to the 4th cervical vertebrae, what you saw was essentially a hole in the vertebrae, is that correct?
Yes.
And it was a pretty small hole, is that accurate?
Yes.
And Dr. Ross detailed this in her report. A stab wound to the 4th cervical vertebrae, what kind of effect would that have on a person?
That would depend the angle that this sharp pointed object would go through the body. So if it went straight through, it would be cutting through or puncturing things in the upper airway, creating a hole in the airway. If it had gone in from the side, it's possible that some vessels could have been interrupted in that, as with or without the airway. That could have led to bleeding and breathing blood into the lungs, or it could have led to blood loss from the vascular or vessel injury.
A stab wound to that area of the neck, would it possibly be fatal?
It's possible, yes.
And that stab wound or the puncture wound that you and Dr. Ross saw on that vertebrae, that was different than the cut sites that you witnessed on the body. Is that correct?
Yes.
Can you explain the difference between the puncture wound and the cut sites?
Well, the puncture wound is a puncture wound. So if you were to, say, just have some Play-Doh or something and stick a toothpick in it, for a short distance, that would create a puncture wound. It's kind of a shallow, just hole, basically, into the bone. The cut marks created a relatively, from far away, a flat surface of the bone, but when you look at it more carefully, it kind of has ridges in it that correspond to the ridges in the saw blade. So that's an entirely different looking injury.
Okay, so the cut marks, the entire plane of the bone had been cut across. Is that accurate?
Yes.
And with the puncture wound, there's just a little hole in the vertebrae.
Yes.
At some point, did you attempt to come to a conclusion about the cause of death for Laura Ackerson?
Yes.
And what was your conclusion?
Well, my opinion as to the cause of death in this case was undetermined homicidal violence.
And what specifically did you find with respect to the injury at the fourth cervical vertebrae?
I called that a sharp trauma puncture wound of that vertebra.
And then the thyroid cartilage that we talked about earlier, was that useful for you in making your opinion?
Right. There was that was not an anatomic finding. That was a pathologic finding, and suggestive of asphyxia or some other type of blunt trauma of the neck.
So in making your conclusion of undetermined homicidal violence, you looked at that puncture wound to the vertebrae?
Yes.
And you also looked at the thyroid cartilage that had been crushed?
Yes.
And then, of course, this conclusion is made much more difficult because there had been post-mortem dismemberment.
Well, that actually helped with the conclusion.
Okay.
Yes.
Okay. But when you are looking at these areas of the body, obviously they've been decomposed.
That's correct. And so, we're seeing bone and we're not seeing the soft tissue and specifically what is injured. So yes, that makes that evaluation more difficult.
And specifically using Dr. Ross's report, you noted that there are 8 different cut sites on the remains.
Yes.
Could you explain to the jury what you mean by undetermined homicidal violence?
It means that taking into account the circumstances of the death or the state of the body, and in following an autopsy examination that might have some suggestions of trauma, but no definite cause of death, that, in my opinion, that this was a death due to external means, and that the external means were intentionally inflicted. But I cannot tell you for sure what the cause of death is.
But both that stab wound and the crushed thyroid cartilage were factors that you relied upon in coming up with this conclusion?
Yes, that's the violence part of it.
Just a couple more questions. When a person dies, physiologically, what happens to the body at that point? If someone is strangled to death or stabbed, what happens to the body over the next day, days, and week? I guess that's kind of an open-ended question, but when someone dies, the body begins to decompose. Is that accurate?
Well, if it's just left somewhere without attention,
Okay.
yes.
So if it's left someplace, for instance, a bathtub, what would happen to the body as it sits there?
Well, depending on multiple variables in a particular environment, whether or not there's water in the bathtub, whether the water continues to run, whether the hot water continues to run, will affect the rate of decomposition. And again, that will cause the microorganisms that normally live in your body, especially in your intestinal tract, will start to basically feed on the body, create gases, travel through the bloodstream, cause the blood in the bloodstream to hemolyze, or the little blood cells will burst and leaving no blood in the tissue, in the vessels. The organs all start to break down because the bacteria are affecting them. If there are flies or bugs or dogs or cats around the bathroom, they can feed on the body. So you can have tissue removal, you can have the action of the insects creating more artifacts and holes. So it just depends on the
After
environment.
3 days, if a body is, I guess, put on ice, but otherwise not much is done with it, or there's some dismemberment, do the tissues start to break down?
Yes, that will happen to a certain degree, really no matter how well a body is refrigerated, but the colder it stays, the slower that process will occur.
And then if a body is, I guess you heard that parts of this body were recovered in a creek in Texas, if the water temperature is 89 degrees and the air temperature is 100 degrees, would that lead to quicker decomposition of the body?
Yes.
And the remains that you received as part of your autopsy, were those consistent with a body being outside in water like that and heat like that?
Yes.
What effect, if any, would muriatic or hydrochloric acid have on a body if it was poured on tissue of the head, for instance?
The acid would cause skin breakdown, and that if the body is then also left, to the elements or whatever, that would kind of create an entrance for organisms or flies, fly eggs, that sort of thing, and could speed up the decomposition process, or especially really that would have more of a destructive effect on the tissues that it was poured over.
Based on your experience, 24, 48 hours after a person has died, and if the body is just left someplace, or it's cut, would there be an odor associated with that?
In the hot, wet environment,
No,
or
just a standard environment, room temperature.
most likely, yes. I might not think so, but
Okay.
most people would think so, yes.
And after 3 days, would that odor increase and increase?
To a point, yes.
After a person's died, when dismemberment occurs, would there be a lot of blood flow, or how would bodily fluids react to a person being dismembered after death?
Well, that probably depends to some extent on how long after death, but there still is going to be blood in the vessels, in the arteries, so it's not going to be active bleeding, but it will be leakage of the blood every time a major blood vessel is interrupted in the cutting process.
And additionally, were you familiar with, in Dr. Mambo's autopsy, he stated that there was some hemorrhaging on the scalp area?
Yes.
If a head was transported in a certain way, could that lead to the pooling of blood in a certain place on the head?
That's possible, but that wouldn't necessarily or usually leave a discrete area of apparent bruising.
Okay. And you mentioned bruising. Is hemorrhaging the same thing as bruising?
Bruising is when the blood vessels are injured so that blood leaks out of them. So it's kind of a passive process caused by vessel injury.
And that bleeding or hemorrhaging that was noted by Dr. Mambo, would that be fatal?
Not necessarily.
If someone got, I guess, hit in the head, could that cause that hemorrhaging?
Yes.
And that person would be able to walk around and continue their life?
Yes.
However, if a person was stabbed in the neck and it hit one of those vessels near the person's airway, that could be fatal.
It could be.
Nothing further, Your Honor.
All right, questions?
Yes, Your Honor, thank you. Good afternoon, Dr. Raj.
Hi.
How are you?
All right.
Good. In determining the cause of death, you indicated that they're separate and apart from the fact that this Laura's body was dismembered. You found two things that could have been the thing that caused her death. Am I understanding you correctly?
Yes.
And one of those would be strangulation. That's a possibility.
Yes.
Am I right?
Yes, sir.
And then the second would be that there is a puncture wound, I believe you said, to the fourth cervical vertebra that could have been caused, for example, by a knife.
Yes.
And that could have been the cause of death.
Yes.
Let me assume, let's assume for the moment that Laura had been strangled to death and that she was deceased as the result of the strangling. The puncture wound in her neck, in the fourth cervical vertebra, would not have contributed to the death, right?
Well, two different types of injuries could have been inflicted.
Right.
So I'm not.
Well, I'm trying to be careful in the way I ask my questions, so I'm probably not doing a great job. But let's assume that Laura was strangled to death and that she died as a result of strangulation. And that the person that did that then, for whatever reason he might have had, stuck a knife in her throat.
Objection.
Sustained reference to gender. You can rephrase.
Is it possible, based on your examination, that the knife wound came after the strangulation?
I think that both the injuries are so recent that I would not be able to tell which one happened first or second.
Okay. How much blood is in the human body?
Oh, I can never remember. About 5 quarts or so, I believe.
Okay. I believe you've also indicated that based upon your examination of the saw wounds to the various different portions of the body, that those wounds were done with a saw of some kind with 14, taking it down, you tell me, 14
Teeth per inch.
inch per inch.
Teeth per inch.
Okay. Are you familiar with a reciprocating skill saw?
I haven't studied about those. That is the tool mark person's
In,
study.
In your business as a pathologist, do you sometimes have to cut through bone?
Yes, we use an oscillating saw for that.
Okay. And if, do you have any opinion as to how difficult it would be to dismember a body with a reciprocating skill saw?
I don't have any personal knowledge of that. I know that some of the difficult factors are actually getting to the bone through the tissue, because our saws and a lot of saws don't cut through tissue very well. Once you get to the bone, it's, you know, that's where the saw is better, on the bone and not in the soft tissue. But and then of course it's going to depend on which bone, where in the bone, that sort of thing.
Would it be fair to say that using a reciprocating skill saw to dismember an individual's body would require that there be a great deal of damage to the flesh and to the bone?
I think if you're only using the saw and trying to go through the flesh, that would leave more damage than if you understood to cut through the flesh and soft tissues to get to the bone.
Say that again for me.
Okay, so if you are just using the saw, it's the only thing you have, and you're starting from the skin and going to the bone, that is going to cause, the tissue will catch up in that saw, and it will kind of muck it up and make it more difficult. But if you understand that that's going to happen, then you go get a knife and cut through that tissue and kind of create a path so that the reciprocating saw doesn't have to go through all that soft tissue and get it right to the bone.
So if you used a knife, in other words, you wouldn't have as much debris flying about
Yes, that's what I think.
that if the knife was used. If the reciprocating skill saw was used and a knife wasn't used, then you would have, or you would expect to have, a great deal of bodily debris flying about, wouldn't you?
Well, I don't know about flying about. I don't know what's going to.
It's causing a lot of damage to the flesh, isn't it?
Yes, but whether that is going to be flying about or whether it's going to just get tangled up in this hole that you're attempting to create, I don't know.
You just don't know. Would it be fair to say that when that reciprocating skill saw strikes blood vessels, that there's going to be a lot of blood spray?
I think that there would be blood spray from that, yes.
I have a moment trying.
All right.
That's all I had.
All right, anything else?
Just briefly,
Okay.
with you're asking questions about the cutting in with the saw. As you cut through the skin, would it leave a jagged edge on the skin if you used a reciprocating saw?
I think it generally would, yes.
Nothing further.
Okay.
May I ask one other thing?
All right.
You had talked about strangulation being one of the possible causes of death.
Yes.
There are a number of things that can be used to strangle someone to death, aren't there? For example, you can do it with your hand. Would that be one way?
Hands?
Hands.
Yes.
A rope would be another way.
Yes.
The cord on an Apple computer would be a way to do it, wouldn't it?
It could be, yes.
Thank you, ma'am.
Right, a ligature strangulation.
That's all.
Okay. All right. Thank you, Doctor. Thank you very much. Is Dr. Rose excused?
Yes, Your Honor.
All right. Thank you. Who's your next witness?
Sergeant Bobby Latour.
Let's why don't we take the afternoon break for about 10 minutes. Obviously, don't discuss the case among yourselves. Don't make your mind about it. Don't or express any opinion about the guilt or innocence of the defendant or any matter in controversy, please take about 10 minutes, come on back to the jury room, and we'll proceed on at that time.